Hello everybody, welcome back to my channel and welcome to Vlogmas Day 8. I'm Lisa, I'm a registered nurse and I've been a pediatric nurse most of my many years in my career and have loved it very, very much. I love kids, I love anything related to maternal child. I think that hepatitis B is something that's important to talk about right now for a few reasons. One of them being that it's on every social media outlet out there. People are talking about it, people are arguing about it, and in the United States, things are changing significantly with what the recommendation is for childhood vaccines, and specifically with hepatitis B. I think it's important to talk about it because there are a few really big questions that people have, and I have them too. And personally, I think the questions are very good. So let's answer them together. And I'm going to give you the facts. I won't give any personal information about stories about my time with seeing children with liver disease or what my personal feelings are. I just want to stick with some facts. And I do realize that even though I'm going to put facts below, information, quotes, etc., numbers and statistics, I still understand that there are people that are going to say, I don't believe it and I don't care. So let's start with the question, what is hepatitis B? Hepatitis B is a viral infection that affects the liver. It can cause an acute infection of the liver. Acute means a short-term illness, or it can be a chronic infection, which can affect a person for their entire life. Most adults who get hepatitis B can be treated, and they have to be treated, though, throughout their lives. And the problem, though, with this hot topic of why in the world would we vaccinate a baby or a child in the first 24, 48 hours of life if the mom is hepatitis free? Okay, that's a very good question. I have that question too. And there are answers to that. And I'm going to try to not go down into the weeds with this, because I've had feedback that I do that too much. So let me just stick with the basics. Because infants and children who are affected or get infected with hepatitis B have a difficult time fighting this infection off. If they get it early in life, they will spend many years possibly symptom-free, but it will catch up with them if they become infected with hepatitis B. What can we do about that? Well, the best thing would be to get vaccinated, but that's just not the only answer. Why still? Why would we want to do that? Because let's talk about how is hepatitis B transmitted. It has shown up in breast milk, in saliva, in semen, in blood, vaginal fluids, other body fluids. And so why this is significant is because if it is transmitted through those areas that I just mentioned, how would that affect an infant or a child who is vulnerable now to this illness? It would, because if hepatitis B can be transmitted through blood, sometimes there's blood on nail clippers, sometimes there's blood on hair clippers, on scissors that people use, with razors, and of course needles and syringes. But again, it's, well, why would that matter? We don't use razors in our house, or we don't use syringes in our house. Again, that's a good question, because it doesn't take much. So if a little child or a baby has, for example, had nails trimmed and they have a cut, or they just have cuts on their hands, but Uncle Joe, who lives in the house, doesn't know he has hepatitis B, he's using things, has saliva, is transmitting this virus unbeknownst to him. So people can have this virus for many years, as it can be hiding in the body symptom-free. So people you come in contact with, friends and family, people that take care of your baby or child in a daycare, a healthcare worker, you bring them to a home daycare, it doesn't matter. It is easily transmitted through anything that has to do with the things that I named above. And sometimes mothers don't want to get tested to see if they have hepatitis B, because they would, people think, well, I would know. No, again, it is silent for many, many years. So people don't always know that they have it. And so, or you might test negative, and then a couple years later, you are positive, but you choose to not get tested again, and then you maybe give birth, or you take care of an infant, or you're breastfeeding. Worldwide, it is estimated, and I will link the information below, that 296 million people worldwide are living with chronic hepatitis B. And most do not realize that they are infected. So here's a question, how in the world then would they figure it out? Well, if they don't do testing yearly with some labs that they automatically get done, or they go get a physical, or they just say, I don't use needles and I don't have casual sex, and so I would have symptoms. But what happens is eventually those symptoms are going to start coming out in things like yellowing of the eyes, nausea, vomiting, diarrhea, abdominal pain, abdominal swelling, fatigue. Eventually the person is going to get sick. Sometimes it's earlier and sometimes it's later. And think of vaccines like a seatbelt. It is protection. And we don't always know when a crash might come. We don't always know when an illness might come. But the protection is there for that child early on in life, or later on if the parent gives it to the child. Is it still effective if the baby gets it at 4 months or 1 year? Yes, it is still effective, and it's good that adults get it too later on in life. The thing is those vulnerable months and years are out there in the open that the child was without a seatbelt. It's a form of protection for that child, because it isn't just about an infected mother giving birth. Do people die from hepatitis B? Yes, it is now estimated that 820,000 people die each year from hepatitis B and related complications such as liver failure. Approximately 2 people die every minute from hepatitis B. Hepatitis B in the United States, up to 2.4 million people is the number that are chronically infected in the United States. Chronic hepatitis B is way more common than chronic hepatitis C, way more common than HIV. It's happened now in this world, especially in the United States, where people want choices and they want to make decisions for themselves. Women refusing to get checked for HIV, women refusing to get labs done, women deciding they don't want a lot of things during their pregnancy and childbirth, parents deciding that even though a leukemia might be curable for their child, the odds are definitely in that child's favor, they're going to choose to not treat the child. We saw that an awful lot. But, each person in the United States has a choice for most of these things. So again, back to it's really not that infectious. I don't know anybody who has it. Keep in mind that it's dormant. It can lie without symptoms for many, many years, but it is up to 100 times more infectious than HIV and AIDS, not just a little bit more infectious. The biggest concern is misprotection at the beginning of this child's life. Protection might come months later or years later when a parent or a family member decides they want to vaccinate their child now. But all of that time they were at school or in daycare or being cared for by family members who might be hepatitis B positive. You don't know. We don't know everybody's status. That puts the child at risk until perhaps they're going to finally get that vaccine. But what we did see were pediatricians wanting very much to work with a parent's decisions. They wanted to stagger vaccines. They still do. They want to be in charge of when the vaccines are going to be given. They want to decide which vaccines they want. And the best thing to do is to do your own research and figure out, if I skip this one, what are the side effects? What could be the most dangerous one to skip? Or I want to just delay some for my own comfort. And the pediatrician or provider will work with you on that. But if a dose is recommended and has been shown to have saved lives worldwide, there needs to be a good reason why you might want to skip it. And so what we saw a lot was the parents would want to stagger or change the schedule. They had every intention of coming back in or making another appointment. Like we all say, we have good intentions. I'm going to come back and get my labs. And then it's so hard to come back and get labs done, or it's so hard to follow up and get that x-ray done. We want to come back and have a vaccine done perhaps for our child, but it doesn't happen. And the delay goes on and the child is not protected all of those months or all of those years. Is hepatitis B curable? No, it is not. Is it treatable? Yes, it is. Is the hepatitis B vaccine safe and is it effective? Yes, it is safe, and yes, it is very effective, extremely effective, about 95% protection if given at the appropriate recommended time. Hepatitis B vaccine is definitely a game changer. It is one of the biggest public health success stories. By vaccinating infants at birth, millions of future cases of chronic liver disease have been prevented. Remember, 296 million people are living with hepatitis B worldwide. Consider this vaccine for your child at birth. And if you have hesitation, that is completely okay. And it's good to ask questions. It's good to fully and accurately understand, if you choose not to vaccinate, what the outcome might be or might not be. You just have to get all the facts together, and you have to talk with your provider. As always, I will put the statistics, articles, lots of information down below so that you can educate yourself more on this topic. If you like topics like this, if you like myths and facts about medicine, things that are mistakes that have gone on with medicine, medical stories, please consider subscribing. And I'll see you at Vlogmas Day number 9 tomorrow. Oh, and don't forget this, it's free.